Hi, I'm Dr. Jeff. Welcome to my channel, Never Look Back Pain. Because when you get out of back pain that's due to a spinal disc injury in your neck or low back, you never want to look back. I'm Dr. Jeff. I'm an advanced trained non-surgical disc specialist and chiropractic veteran of 20 years. And today I've got a special guest. I've got this guest, Dr. G. Dr. G, welcome to the channel. Dr. G happens to be my father, who I will warmly say Dad from this point forward. Dad, welcome to the channel. Welcome to today's little video here. So you and Mom are here all the way from Naples, Florida. And so the reason you're here is because you're having some back pain. Tell us a little bit about that.
Well, one day I woke up and I had tremendous discomfort in my back, had pain down my leg, and couldn't walk well, couldn't play tennis, but I just wasn't getting relief, and I needed to come up and see you to have you use your technique that you've developed to help me get out of pain. So this is why we came up to see you.
So here's the thing, right? So you live in Naples, Florida, and we're in Shipshewana, Indiana, Northeast Indiana. And obviously there are thousands of chiropractors in Naples, and you even have gone to several chiropractors. And the thing is, though, you've been suffering for a while, and like all great fathers do, they ask their son for advice and then don't take a word of it. So you've been talking to me, I've been telling you things to do, you kind of did your own thing. You saw some chiropractors who were able to help you a bit, but obviously didn't really get you where you needed to be.
No, they did not, may have helped somewhat, but never really achieved the success I was looking for. Again, it's just, when you have pain, it hurts and you want to get out of it.
And so, being an advanced trained non-surgical disc specialist, my father had called me one day and said, I'm done, I just need, what do I do? And I said, Dad, the symptoms that you are having definitely sound like they could be due to a spinal disc injury. I'd like you to get an MRI. So that's what he did. He went down to his MRI, local MRI place in Florida. He wound up getting an MRI, and sure enough, as we zoom in here, things did not look pretty. So I personally analyzed his MRI myself, and we discovered L3, L4, L4, L5, and L5S1 both had some major issues. They had herniations, bulges, arthritic change, tears in the disc, stenosis, and this was the reason why he was having the pain in his leg when he was driving, playing tennis and things like that. So I developed a technique called the Dose method. We have a 90% success rate helping patients recover non-surgically. And I said, Dad, if you want this thing solved, you've got to make a commitment. You've got to come on up, and you and Mom have to come spend 10 weeks with us. So he spent 10 weeks with us in our office going through my method, my technique, and tell everyone how you're feeling today.
Well, I was told 85%. I am at 95, 97%. Really, basically, pretty much pain-free. I'm able to drive. I'm able to walk. And it's just marvelous to be pain-free.
And he's going home like tomorrow, and he's excited.
Yeah,
so
very.
We had conversations over the weeks that he was here. And I remember one conversation in the kitchen where it was in the very beginning, and we just started with you, and you were still quite a bit of pain, and you came back from the office, and I came back kind of late, and we were standing in the kitchen, and you'd said to me, I just don't understand why my back looks like that. How come I didn't know? And one of the things we talked about is, my dad being a dentist of 40 years, I said to him, Dad, what are dentists very good at teaching? What is the American Dental Association very good at marketing is, without pain for your teeth, what should you do?
You should have a checkup every 6 months to go see the dentist for a dental checkup.
Because you have pain or no?
No, because you want to make sure you do not end up having pain.
And so what we said was the Dental Association and dentists of 40 years were very good in marketing and driving into people every 6 months. And you know what I said to him was, why did it have to be 6 months? Why couldn't it be 3? Why couldn't it be 5? Why couldn't it be 7? And the truth was he didn't have an answer. But the truth is the American Dental Association thought, for whatever reason, every 6 months, and they got people to believe and realize that regardless of pain, you should have your teeth checked, because decay and damage can show up regardless of pain, and pain usually is the last thing to show up. So when he got to see his MRI in person, when he finally came up and got to see it in person, he was kind of in shock that, my goodness, why didn't anybody tell me this? And we talked about how the chiropractic associations and the chiropractors, are they very good at promoting this?
Yeah, I mean, they. Well, again, as an dentistry, yes. I mean, you were good in promoting and indicating, though, that you really needed to have a definitive diagnosis, X-rays or MRIs, and this is what was lacking in my treatments prior to my coming here.
Right, so the dental association got everyone to believe, get an x-ray, see what's going on, see for your eyes, because to treat you need to see, otherwise you're guessing.
Right.
And so the chiropractic profession as a whole tends to go into the spine without seeing, x-rays or MRIs, we could do that later if need be, but the thing is, how is a person supposed to know what's going on? And truthfully, by the time you have back pain, at that point typically your spine's not looking very good.
Right.
Let me ask you this though, and we talked a little bit about this. If a tooth is badly decayed and it's rotted out, what's a solution for a dentist to do for a person?
Well, to extract the tooth, eliminate the pain by extracting the tooth.
Get rid of the tooth,
Yeah.
put in a new tooth.
Yeah.
The difference is you cannot do that to the spine, right? You cannot just eliminate the tooth. You can't eliminate the spinal bone and just put a brand new spinal bone with disc in there and everything's going to be A-okay. So it was a great learning experience for a 40-year dentist to talk through that and get these aha moments of, why didn't anyone tell me? Well, our profession isn't doing a great job like your profession had done in order to get people to see that you need to see things in order to treat them. So one of the things we did was we sent for that MRI, and man, you were kind of shocked to find out there was quite a bit of damage in there.
Yeah, I certainly wasn't I? Yeah.
And I told you, I believe I get you somewhere around 85% better with the technique we use, the technology and the technique and things like that. And I developed a technique called the Dose method. And so let's talk about how you're feeling today. You're 10 weeks done today, finished last treatment. You're going home tomorrow. Tell the audience.
Well, to me, it's just an eye-opener to kind of come up here 10 weeks ago and be in such discomfort, and to have Dr. Jeff do his special technique that they have. And today, I'm basically pain-free, as I indicated to you. I'm very excited about going back to Florida so that I can get back to my gym, work out, do my tennis, which I love, and know that I'm basically pain-free and I can go do it, whereas before I really couldn't do it anymore. And so you've really achieved, as I said, you indicated to me 85%. Well, how about 98, 99% I'm pain-free? And that's just marvelous achievement. I sincerely appreciate and thank you for that. And I'm sure that all the patients that do see you will get the result of pain.
Well, I had the privilege and the benefit of having my parents around for 10 weeks. I had the comfort in knowing that I was able to help my father over 10 weeks get back to tennis and moving and driving and living pain-free. And it's what we do in our clinic at the Midwest Disc Clinic. We developed this technique to give people back their lives, because once you're out of pain, neck pain or back pain due to a spinal disc injury, you never want to look back.
That's for sure.
I'm also the author of this little book right here, Never Look Back, A Simple Guide to the Cause and Care for Back Pain. Why did I write this little book? Because there are thousands of people every single day suffering like my father that don't know why. They're seeing doctors, there's no imaging, there's no testing, they just treatment after treatment and they don't know why. And I designed this little book to give you the idea of what could be causing your back pain? What are the things that cause back pain? The testing that your doctor should be sending for right now, regardless of insurance, because if they're not sending right now, they're wasting your time. Fire them if they're not sending for certain tests. We talk about those tests in here. We talk about the 5 ways you unknowingly hurt your back, and he was doing some of them in the gym. The 5 ways you unknowingly hurt your back and your disc, and the 5 ways to prevent that. We also talk about a technique I developed to help you, the spinal disc injury sufferer. You go to neverlookbackpain.com, you go to midwestdiscclinic.com, grab the book, check us out. Dad, I want to say thanks for being with me on the channel today, and thanks for being in my life for 10 years. And man, I'm happy to know that we're sending you back to life happy and pain-free.
And I thank you, Dr. Jeff. It was a marvelous time, but more importantly, as marvelous as it was, it really ended up being a very beneficial time for me, getting me back to where I want to be, pain-free. Thank you.
Gang, I get to help people, and this time I get to help my dad. Have an awesome day. We'll see you soon.